Did you know that stopping having sex after 60 isn't just a you get older thing? In fact, it can have dire consequences that few people dare admit: irreversible erectile dysfunction, a serious drop in testosterone, even painful chronic prostatitis, and the risk of deep depression. These are not empty warnings, but facts proven by leading medical experts, including Dr. Khera, a urologist with many years of experience researching men's health. Your body cannot repair itself if you neglect these essential physiological activities, and that absence is silently destroying your physical and mental health. Did you know that just a few masturbations or sex sessions a week can help maintain hormones, keep nerves alive, and prevent a series of dangerous diseases? Don't let silence and fear make you lose yourself. If you want to understand more about the potential harms and how to protect men's health in a simple and effective way, please leave a comment to share your thoughts, and don't forget to subscribe to the channel so you don't miss the next valuable videos. Change starts with you. Take action today. Dr. Khera gives an important warning about men's health when they turn 60, emphasizing that completely stopping sexual activity can lead to irreversible erectile dysfunction. He explains that when the body is no longer stimulated and operated through regular sexual activities, it not only stops but also begins the process of degenerative physiological functions. The penis, he says, is a special organ that needs to be operated regularly to maintain its health through stable blood flow. When sexual activity is interrupted or completely disappears, blood flow to this area gradually decreases, causing a lack of oxygen to the tissues. As a result, the tissues begin to fibrous, the nerves are damaged, and erectile function gradually declines irreversibly. This situation occurs very quietly and unclearly, causing many people to only realize when the condition has become serious and difficult to treat. In addition, Dr. Khera also pointed out that maintaining regular sexual activity, even if it is only once or twice a week, is essential to help keep blood circulation flowing, while also keeping the nerves active and helping the body realize that this function is still important and necessary. This maintenance not only benefits the body physiologically but also positively affects the mental and emotional health of older men. Another aspect he mentioned is the decline of the hormone testosterone, one of the important factors in maintaining men's sexual and overall health. Stopping masturbation or sexual activity can accelerate the decline of this hormone, which has a profound impact on physical and mental health. Dr. Khera emphasized that masturbation is one of the few natural, drug-free ways to stimulate testosterone production in older men. Regular sexual experiences that produce arousal and release send important signals to the body, helping to regulate hormonal rhythms and maintain hormonal balance. When sexual activity is stopped, the body sends the opposite message, thinking that intimacy is no longer necessary, thereby reducing the production of this important hormone. As a result, many people begin to lose interest, have a reduced ability to concentrate, have weaker muscles, more brittle bones, are prone to depression, and have an increased risk of cardiovascular disease. Many people feel they no longer recognize themselves when they look in the mirror, a clear manifestation of both physical and mental changes. In addition, he also emphasized the problem of prostate congestion, a common but under-recognized problem in older men. The prostate is an active gland, producing and storing secretions that need to be discharged regularly. Lack of ejaculation causes secretions to stagnate, making them thicker, increasing pressure in the gland and making it susceptible to infection. Common symptoms include weak urine flow, discomfort in the lower back, and a constant urge to urinate even when the bladder is not full. If left untreated, chronic prostatitis can develop, causing pain and severely affecting the quality of life. Research from Harvard and many reputable organizations has shown that frequent ejaculation can help reduce the risk of prostate cancer by removing harmful deposits in the gland. Finally, Dr. Khera does not forget to mention the mental and emotional effects of ceasing sexual activities and masturbation. He believes that this is the most silent but devastating consequence, deeply affecting the sense of self and happiness. The lack of intimacy, even with oneself, can cause feelings of emptiness, loneliness, and emotional loss. Neurotransmitters such as dopamine, oxytocin, and endorphins released during masturbation play an essential role in regulating mood, reducing stress, and maintaining emotional stability. When these substances are lacking, men are prone to depression, social isolation, and cognitive decline. Many do not realize that the emotional numbness they are experiencing is a consequence of their previous decision to stop being intimate. In conclusion, Dr. Khera rejects the popular view that desire and intimacy are things to grow out of with age. He emphasizes that negative changes are not due to aging, but rather the result of neglecting to maintain necessary physiological activities. Maintaining sexual activity, including masturbation, is a way to preserve one's vitality, wholeness, and true self. The body still remembers how to feel, the mind still craves connection, and overall health still depends heavily on whether we honor the deepest parts of ourselves. Therefore, he advises older gentlemen not to hesitate or be ashamed to choose health and vitality over silence and abandonment. The penis needs to be operated regularly to maintain its health through stable blood flow plays a key role in maintaining male physiological functions, especially erectile ability. When the body is not stimulated regularly, blood flow to the penis will decrease, causing the process of supplying oxygen and nutrients to important tissues to be seriously affected. This lack of stimulation leads to poor blood circulation, causing the tissues to gradually become stiff and lose their inherent elasticity. In addition, nerve damage also develops silently over time, contributing to prolonged and difficult-to-recover erectile dysfunction. This decline occurs slowly and unclearly, causing many people to not recognize the warning signs in the early stages. When symptoms begin to appear clearly, physiological function is often seriously damaged, significantly affecting men's quality of life and confidence. Faced with this situation, medical experts, including Dr. Khera, recommend that men maintain regular sexual activity, including having sex or masturbating at least once or twice a week. Maintaining this habit not only helps ensure stable blood flow, but also keeps the nerves working effectively and the penile tissue maintaining the necessary elasticity. Such regular functioning of the genitals is considered a natural and effective way to protect physiological health, minimizing the risk of erectile dysfunction in the long term. In addition, regular sexual activity also contributes to improving overall health, promoting blood circulation throughout the body and balancing hormones, thereby improving the quality of life and spirit of men. Ignoring the importance of regular physiological stimulation can cause the body to gradually lose its ability to respond normally. When tissues are fibrotic and nerves are damaged, recovery becomes difficult or even impossible. Therefore, maintaining a moderate frequency of sexual activity, appropriate to physical condition and age, is essential to help men maintain their physiological health and confidence in life. This is also a way to help reduce psychological problems such as stress, anxiety, or insomnia, which often accompany decreased sexual function. In short, maintaining stable blood flow through regular sexual activity is the key to helping men protect and prolong their physiological function. Regular stimulation not only keeps tissues and nerves in the best condition, but also helps the body realize that this function is still very important and needs to be maintained. Therefore, actively maintaining the habit of having sex or masturbating at least once or twice a week is a simple but very effective measure to prevent erectile dysfunction and maintain overall health in men, especially in old age. Masturbation is considered an effective natural method to stimulate the body of older men to produce testosterone without the need for medication. This is an important activity because testosterone plays an essential role in maintaining men's physiological, physical, and mental health. When men regularly have sexual experiences, whether it is intercourse or masturbation, the body will receive important signals to regulate and balance hormone levels, especially testosterone. This process helps maintain hormonal stability, ensuring that physiological functions operate smoothly and effectively. On the contrary, when sexual activity or masturbation is interrupted or stopped, the body will send a false message that closeness and intimacy are no longer necessary. This leads to the gonads reducing the production of testosterone, a hormone that is essential for maintaining energy, desire, and many other important functions. The decline in testosterone has many obvious negative consequences for men's overall health. First of all, there is a decrease in sexual interest and concentration, causing men to gradually lose the enthusiasm and clarity needed in daily life. Not only that, the body also begins to undergo physical changes such as a gradual loss of muscle strength and bone strength, causing physical health to decline significantly. In addition, testosterone deficiency also makes men prone to depression, mood swings, and emotional imbalance. Studies have shown that low hormone levels are closely related to an increased risk of cardiovascular disease, one of the leading causes of death in older men. All of these factors create a vicious cycle when physical and mental health decline, seriously affecting the quality of life and confidence of men. Many people share the feeling of strangeness when looking in the mirror, not recognizing themselves because of the comprehensive changes in both body and mind. They feel weak, pale, and lose the very characteristics that once created their strength and confidence. This condition not only affects the individual but also negatively impacts social and family relationships. Therefore, maintaining sexual activity, including masturbation, is an important factor that cannot be ignored in healthcare for older men. In short, masturbation is not only a form of sexual desire but also acts as a natural medicine that stimulates testosterone production, keeping hormones in the body balanced. This helps maintain physiological, physical, and mental health, while preventing many negative consequences related to hormone decline in middle-aged and elderly men. Understanding and maintaining this habit is an essential part of a comprehensive healthcare strategy for men, helping them maintain strength, clarity, and enjoy life more fully every day. The prostate is an important organ in the male reproductive system, with the function of producing secretions necessary for ejaculation and maintaining physiological health. For the prostate to function normally and avoid health problems, the secretions produced by this gland need to be regularly excreted from the body. When the secretions are not excreted in time, they will stagnate in the gland, causing a thickening phenomenon and gradually increasing pressure inside the prostate. If this condition persists, it will easily lead to inflammation and serious damage to the gland, while affecting the physiological function and overall health of men. Stagnant secretions in the prostate not only put a lot of pressure on this organ but also cause unpleasant symptoms for the patient. Men often encounter problems such as weak urine flow, difficulty urinating or incomplete urination, dull pain in the lower back or lower abdomen, along with a constant feeling of needing to urinate even when the bladder is not really full. These symptoms significantly affect the quality of life, causing fatigue, prolonged discomfort, and can reduce the patient's work performance and spirit. If the stagnant secretion is not intervened and treated in time, it can progress to chronic prostatitis, a persistent disease, difficult to treat and causing many long-term troubles. Chronic prostatitis not only reduces the quality of life but also has the potential to lead to more serious complications, including the ability to affect fertility and increase the risk of other diseases related to the urinary and reproductive systems. Therefore, maintaining the secretion function of the prostate is very important to prevent these complications. One of the simple and natural ways to maintain the smoothness of the prostate is to ensure regular ejaculation. Ejaculation helps to remove stagnant secretions, reduce pressure, and prevent the accumulation of substances that can cause inflammation or damage to the gland. Many reputable medical studies, including famous research projects from Harvard University, have shown that maintaining a regular ejaculation frequency can help reduce the risk of developing prostate cancer. The reason is that when the prostate is eliminated regularly, toxic accumulations that can damage cells and increase the risk of cancer will be effectively eliminated. This not only helps protect physiological health but also contributes to improving the overall health of men in middle age and old age. In addition, maintaining regular ejaculation also has a positive impact on mental health, helping to reduce stress and improve mood. This supports the process of regulating hormones and balancing hormones in the body, while keeping physiological functions in the best condition. Therefore, men should pay attention to maintaining this healthy habit as part of a comprehensive healthcare regimen, especially when entering the age when they are susceptible to prostate problems. In short, the prostate needs to secrete secretions regularly to avoid stagnation causing inflammation and uncomfortable symptoms such as difficulty urinating, back pain, or frequent urination. Regular ejaculation not only helps to clean secretions, reduce pressure in the gland, but also helps prevent the risk of chronic prostatitis and prostate cancer. This is one of the simple, effective measures recommended by medical experts to maintain physiological health and overall health of men, especially those of middle age and older. Understanding and implementing it regularly will help men proactively protect themselves, improve the quality of life, and prolong their health for many years. Not only does the lack of intimacy have negative physical effects, it can also have a profound impact on a man's mental health. When there is no longer an intimate connection, even with oneself, many people experience feelings of loneliness, emptiness, and a feeling of not being appreciated or acknowledged. This lack is not only a social or emotional problem, but also directly affects the biochemical activity in the brain, which produces important neurotransmitters that help maintain a stable and happy mental state. Neurotransmitters such as dopamine, oxytocin, and endorphins play a key role in regulating mood, reducing stress, and creating feelings of joy and satisfaction. Masturbation and other sexual activities help stimulate the natural release of these chemicals. When men maintain regular intimate activities, these chemicals are produced regularly, helping them maintain emotional balance and mental health. Conversely, the lack of intimate experiences reduces neurotransmitter levels, increasing the risk of psychological problems such as depression, social isolation, and cognitive decline. Depression and isolation due to a lack of intimate connections also negatively affect quality of life, causing men to feel a loss of motivation and interest in activities that used to bring joy. This feeling of emotional numbness occurs silently but is devastating, causing long-term consequences for mental and physical health. Many people do not realize that the root cause of this numbness is the decision to stop or reduce intimate activities in daily life. This absence causes the loss of an important part of oneself, creating a sense of irreparable loss. In addition, the lack of dopamine, oxytocin, and endorphins not only affects emotional state but also reduces the ability to resist stress and pressure in life. This makes men susceptible to falling into a spiral of negative thoughts, affecting both physical health through manifestations such as insomnia, fatigue, and a weakened immune system. The social and emotional connections maintained through intimacy are important supporting factors that help balance these factors and maintain overall health. Therefore, maintaining intimate activities is not only about meeting physiological needs but also a way to protect mental and emotional health. Continuing to maintain this connection helps men avoid serious psychological problems and maintain the emotional stability needed to enjoy life. Intimacy creates a feeling of being loved, appreciated, and alive, essential factors that contribute to building a healthy and happy life. In short, the cessation of intimate activities can cause deep damage not only physically but also mentally, creating a feeling of loneliness and emptiness in men. Deficiencies in key neurotransmitters such as dopamine, oxytocin, and endorphins increase the risk of depression, social isolation, and cognitive decline, which can have a profound impact on quality of life. Many people do not realize that these emotional problems stem from their decision to stop maintaining intimate connections, which can lead to a silent and dangerous state of emotional numbness. Therefore, maintaining intimacy and connection, even with oneself, is crucial to maintaining mental health and enjoying a fulfilling life. Dr. Khera has spoken out against the common but mistaken notion that a decline in sexual desire and intimacy is inevitable as people age. He asserts that these changes are not an inevitable consequence of aging, but are largely due to people ceasing to maintain essential physiological activities, including sex and masturbation. According to him, this is a big mistake because society often assumes that older people will naturally lose their sexual needs and abilities, leading to a neglect of important factors that maintain the overall health of the body and mind. Sexual activity, whether it is between couples or masturbation, plays an indispensable role in maintaining physiological health, self-confidence, and a sense of self-integrity. This is not only a simple biological need but also an important part of helping people maintain mental and emotional balance. Dr. Khera emphasizes that both the body and mind constantly crave connection, aliveness, and pleasure from intimate experiences. These desires should be honored and fulfilled, regardless of age or living situation. He also encourages older men not to hesitate or be ashamed to continue to maintain sexual activities, because this is the key to protecting overall health and improving quality of life. Maintaining regular intimate activities helps stimulate blood circulation, balance hormones, and keep physiological functions in the best condition. At the same time, it also helps maintain confidence and a sense of self-love, thereby helping older people feel younger, more vibrant, and more connected to life. Instead of accepting regression as inevitable, proactively maintaining and developing a sexual life is an effective way to combat the decline in health and spirit. Dr. Khera also pledges to share specific, practical, and easy-to-apply solutions to help older men maintain and improve their sexual performance in the next article or video. These methods not only help prevent negative health consequences but also contribute to bringing satisfaction, happiness, and meaning to life. Providing this useful knowledge and advice demonstrates his commitment to raising awareness about men's health while breaking down outdated stereotypes about aging and sexuality. In conclusion, Dr. Khera not only refutes the misconceptions about the decline of desire and intimacy in older men, but also affirms the importance of maintaining sexual performance as an essential part of overall health. He conveys a strong message that, regardless of age, the body and mind still crave connection and a sense of vitality, and this needs to be respected and taken seriously. Through this, he encourages everyone, especially older men, to be brave and proactive in maintaining sexual activities to improve health and quality of life in a comprehensive and sustainable way. The views presented in the article are based on the extensive expertise of a urologist and men's health specialist who not only understands medical issues but also has practical experience in caring for and supporting patients. This professional understanding helps the doctor have a comprehensive and accurate view of the physiological and psychological changes that men face during the aging process, thereby providing the most appropriate and effective recommendations to protect their health and improve their quality of life. This view is not only theoretical but has been verified through many real cases, bringing great practical value to the reader. A special point in the doctor's way of communication is the use of personal stories, real experiences from the patient's life or his own to highlight the importance of the issue. These stories help listeners easily feel empathy and at the same time gain a deeper understanding of the possible consequences of ignoring physiological health. The language used in the article is also very strong, straightforward but full of emotion, aiming to attract and stimulate the reader's thinking, avoiding the dryness often found in traditional medical documents. This storytelling style helps the message not only be conveyed effectively but also creates a deep emotional connection between the communicator and the recipient. Not only stopping at analyzing the problem, the doctor also gives scientific advice, based on reliable medical research and evidence. This advice is designed to be easy to understand and apply in the daily life of the reader, to help them take the initiative to take care of their health effectively. This is very important because many people often have difficulty receiving complex medical knowledge and applying it in practice. The simplicity and practicality of the advice helps increase the ability to practice and maintain healthy habits in the long term. In addition, these tips are not only meaningful in terms of medicine but also contain profound messages about respecting and taking care of yourself. They emphasize the importance of maintaining a balance between physical and mental health, and encourage men to care about their physiological health as an indispensable part of a happy and fulfilling life. This contributes to changing social awareness of men's health, eliminating prejudices and fears when talking about this sensitive issue. In short, the presented viewpoint is a harmonious combination of professional knowledge, personal stories, and practical advice, creating a comprehensive and profound picture of men's health in the aging process. This method of communication not only helps raise awareness but also inspires each person to proactively take care of themselves towards a healthier, more fulfilling, and meaningful life. Thank you for watching today's video and taking the time to learn about important issues related to men's health, especially the serious effects of stopping sexual activity in middle age and old age. Hopefully the information we shared has helped you gain more insight, as well as clearly understand the importance of maintaining healthy habits to protect physiological function and mental health. Don't forget that health is not only a physical matter but also a balance of both mind and emotions, and each of us can take the initiative to take care of ourselves to enjoy life more fully. If you find the video useful, please take a moment to click the like button to support the channel, share your thoughts and questions in the comment section below so we can accompany and answer with you. Subscribe to the channel and turn on the notification bell so you don't miss any of our upcoming videos, where we'll bring you more useful knowledge and practical solutions to help you improve your health and quality of life in the most effective way. We appreciate your interest and support in your journey of men's healthcare. Remember, every small step you take today will make a big difference in the future. Thank you for trusting and choosing our channel as your trusted companion. See you in the next videos with more interesting and practical topics.